ಕ್ಯಾಮರಾ ಗೊತ್ತಿಲ್ಲ ಅನ್ಸುತ್ತೆ. Hello, Namaste. I welcome you all to this YouTube live program on the holy occasion of Shri Danvantari Jayanthi. Usually, one day before Naraka Chaturdashi or one day before Deepavali, the day is celebrated as Dhanteras or as Danvantari Jayanthi, and in that we celebrate and we do puja of Lord Bhagavan Dhanvantari, and we pray God Dhanvantari for health, longevity and disease-free life filled with happiness. So on this holy occasion of Danvantari Jayanti, I pray at the holy feet of Shri Bhagavan Danvantari for health, happiness and longevity for all of you. So coming to the topic of the day is misconceptions regarding Ayurveda. As we speak, if you have any doubts, please feel free to type your questions in the chat section, in the comment section. I will try to cover as many questions as possible in this session, and if some questions get left over, we will of course take up those questions in the next session of YouTube Live. I am Dr. J.V. Hebbar. I am the Managing Director and Chief Ayurvedic Physician of Easy Ayurveda Hospital. We are located in Mangaluru, Karnataka, India. So before I start, I cordially invite you all to come and experience authentic Ayurvedic treatment at Easy Ayurveda Hospital in Mangaluru, Karnataka, India. So coming to the topics, first misconception is that usually there is a big public misconception that Ayurveda can only cure a certain number of diseases only. This is not true. From top till the bottom, from hair loss to facial skin health problems to brain diseases to psychotic disorders such as schizophrenia, mania, bipolar disorders, insomnia, sleep problems. From there to headaches, migraine, all the neurological problems, to diseases related to eyes, nose, ears, throat, oral cavity, even dental problems, to the respiratory tract, digestive tract disorders such as irritable bowel syndrome, to gastritis or what we call as a gastroesophageal reflux disorder, bloating, constipation, to diseases related to kidney, pancreas, liver, joints, bones. You take whichever organ in the body, we treat all those diseases. Ayurveda is capable of showing good results in many of the health ailments, and it is not only related or it is not only restricted to treat, for example, osteoarthritis or bones disorders, so on and so forth. Second big misconception that people have is that Ayurveda is only useful in long-term diseases only, and Ayurveda cannot cure acute conditions. It is again not true. We at Easy Ayurveda Hospital treat as acute disease as migraine, headaches, even in some cases fever, also cold, cough. For common day-to-day problems also, patients visit us at Easy Ayurveda Hospital and we treat them quite regularly. So it is not that we treat chronic diseases alone. Of course, we get a lot of clients having chronic asthma, joint disorders, arthritis, or a low back ache, with patients suffering with these complaints for many years, and they come for treatment and we treat that. That does not mean that we do not treat day-to-day common problems of common people. Next is another misconception is that Ayurveda medicines take a very long time to show its results. This is also not very true. There are many medicines which, for example, pain relieving Ayurveda medicines with Ayurvedic herbs such as Gugulu, Shallaki, Nirgundi or Vitex Negundo, etc., which when used properly, they can show instant results also. For example, a person with allergic dermatitis, with allergic hives all over the body, we can treat that quite fast within just a few days of time. Of course, if a disease is chronic, for example, a person is having a particular skin disease, say, for example, psoriasis, and he is suffering with that for many years, then he comes to us at the hospital for treatment. Of course, in that case, we are going to take a bit longer time to show results. In such cases, because the patient has been suffering with the psoriasis for 10 to 15 years, they cannot expect to magically disappear all the psoriatic patches in about just 1 to 2 weeks. In those cases, we do Panchakarma treatments with detoxification therapies, and those therapies are helpful to control the symptoms very quickly in about 1 to 2 weeks, and after that we suggest medicines which are given for 1 to 2 months, so that at least it is fair from our point of view to get to seek treatment in the patient for 2 to 3 months when the disease is as old as 5 to 10 years. Next big misconception with the Ayurveda is that Ayurveda is free of side effects. Ayurveda is not totally free of side effects. There will be some or other minor side effects with Ayurveda. So that's why it is very important for all Ayurveda or for all patients to seek guidance and to take advice from a qualified Ayurveda doctor or Ayurveda practitioner and follow the advice diligently. Even as simple as Kumkumadi Tailam, if it is used in a person who is more prone to allergy, it can cause facial skin rashes. Usually, Kumkumadi Tailam is very well advertised in all the social media and in many other digital and online TV and other platforms, that it is useful to improve glow, it is useful to relieve acne, it is useful to improve skin health, complexion, everything they are advertising. But even as safe as that, with very highly reputed company also, sometimes it causes side effects such as allergic rashes. Even as simple as ginger also, for example, in a person with a sensitive stomach, or in certain cases of irritable bowel syndrome, or even in cases of ulcerative colitis, etc., it can worsen the symptoms. So each of the medicines or herbs or home remedies should be carefully watched out, and in the particular condition of a patient, considering his age, considering his tolerance, medicine tolerance capacity, which we call as sattva, considering all these points, an able Ayurvedic Vaidya will draft a suitable combination of Ayurvedic medicines. Next, before we move on to next Ayurvedic misconception and providing solution for that, I urge all of you, if you have any doubts in this particular topic, please feel free to ask your questions in the comment section. I will be more than happy to take them up and answer them live. Next is like how a typical Ayurvedic treatment schedule is planned. First is, so there are many modules that we follow at Easy Ayurveda Hospital. First one is that in a grand scheme of things, if person has asthma or paralysis or migraine or any chronic stomach related problems such as irritable bowel syndrome, etc., if the patient is already suffering for many years and he has sought treatments from various other Ayurvedic doctors or homeopathy doctors or allopathic doctors, so on and so forth. So the patient has already sought treatment from various people and such a person comes to us. Then we usually recommend them Panchakarma treatment. So let me explain in brief about what Panchakarma treatment is, because there's huge amount of misconception related to Panchakarma also. Many people think that only oil massage or Shirodhara or Patrapinda Potali Sweda and so on and so forth, all these simpler things they consider as Panchakarma. Actually Panchakarma, these are not actually Panchakarma, meaning that they do not do any sort of hardcore detoxification process inside the body. Rather, they do only minor sort of detoxification. So Panchakarma is for higher level of detoxification. Of course, I am not saying that oil massage is not useful or Shirodhara is not useful. We use Shirodhara, oil massage, etc., for example, in treating many cases of stress, anxiety, depression, insomnia, weakened memory power, so on and so forth. But these are not like primary detoxification procedures. So Panchakarma is a set of 5 detoxification procedures that are done on the doshas. So coming to the doshas, let me explain a little bit in brief. Doshas are the 3 factors in our body. Vata dosha, that is air and ether element in the body. Next is Pitta dosha, which is fire and water element in the body. And then Kapha dosha, which is earth and water element in the body. So it can be compared to air or wind, water and fire. So these 3 doshas, they are like the software inside our body and mind. So the hardware is the body itself with all the tissues, there is blood, there is muscles, bones, internal organs. So all these can be cumulatively considered as hardware upon which the 3 doshas, which are software, act upon. So when these doshas are acting on these tissues, the health is well maintained. When the 3 doshas, Vata dosha, Pitta dosha and Kapha dosha, are well balanced, then our proper health is maintained. So then the person will live long, he will not have any chronic or long-term disorders. He will not be such a person with all 3 doshas, Vata, Pitta and Kapha in perfect balance. He will not be easily affected by cold, cough, etc. His digestion strength will be very good. His respiratory strength also will be very good, so on and so forth. So, but when this Vata, Pitta and Kapha doshas, when they go up or when they go down, then this condition can lead to diseases. So, what do you mean by Vata dosha going up? Vata dosha going up means the air element in the body going up. Then there will be wind or air accumulation in the intestines, leading to bloating, constipation, or hyperactivity of the intestines due to Vata dosha aggravation causing diarrhea, or air element in our muscles will increase causing muscle aches and pains. and air element, the same air element increasing in our bones will make the bone more porous. So when the bones become porous, then it becomes very difficult to treat. The patient will have what we call as osteoporosis. It usually happens in the old age. So similarly, when Pitta dosha is imbalanced and it is highly aggravated, either it can lead to digestive disorders, it can lead to psychiatric disorders like schizophrenia, mania, etc. It can also lead to increased anxiety. In some cases, it can lead to short-temperedness. Person becomes angry unnecessarily. High Pitta in the body can also lead to high blood pressure, so on and so forth. Then comes to Kapha. Usually increase of Kapha can cause itching on the skin, it can cause many skin disorders, it can cause asthma, it can cause cold, cough, it can cause obesity, lethargy, many such disorders. Increased cholesterol in our blood vessels, all those things are caused by high Kapha dosha. So this Vata and Pitta and Kapha doshas, in a very chronic patient, it will be very high. It is very high because patient is suffering with, say, for example, chronic asthma for a very long period of time. In him, Kapha dosha is very high. It is such a high that just giving some oral medicines will not be sufficient. In case of Pitta, let's take an example of psoriasis. Psoriasis has flared up and patient has severe itching and psoriatic plaques all over the body. In them, the doshas have become too much aggressive, the doshas have become too much aggravated, so only solution in that case is to eliminate the doshas out of the body. So either we have to eliminate the doshas out of the body, or we have to balance them down or calm them down. In a very highly aggravated doshas, in a severe case of psoriasis where psoriatic patches are there all over the body, we cannot simply palliate the doshas or balance down the doshas. Then the doshas have to be eliminated out. So this elimination of doshas out of the body is called as detoxification or detox therapies, and that is called as Panchakarma, a set of 5 treatments in Ayurveda. So coming back to how Ayurvedic treatments are given, usually this detoxification therapy is given in chronic diseases when the symptoms are too much and patient has already tried many medicines, then nothing is happening, then we ask the patient to undergo these detoxification therapies. Usually these detoxification therapies can vary from, the duration can vary from 1 day to 3 days up to 15 to 20 days. It depends on what a detoxification therapy that we do in the patient. One thing that I miss telling you all is that the disease is very rarely single dosha caused. For example, in case of asthma, first Kapha dosha gets increased and it causes cold, cough or difficulty in breathing, etc. And eventually Vata dosha also gets involved in the causation of asthma. So usually in most of the respiratory disorders, it is not just the Kapha dosha which is causing it. Kapha dosha aggravates first and it causes majority of problems, and then it in turn causes aggravation of Vata dosha, and both of them combined together, Kapha dosha and Vata dosha combined together will cause a chronic asthma. Similarly, even in digestive disorders also, majorly because it is Pitta dosha, the main Pitta dosha which causes the digestive disorders. Often Pitta and Kapha may be involved in causing burning sensation, heartburn, and in case of irritable bowel syndrome, Vata dosha may be associated with the Pitta dosha. In severe case of gastritis and bloating, There, the heartburn, the burning sensation in the stomach is caused by pitta, whereas bloating and abdominal colic pain may be caused due to vata dosha. So as similar to how one disease may be a mixture of somebody is saying voice is not clear. I will try to, our team is trying to correct it as we go forward. I'm extremely sorry for that. So, like I was telling, like how a disease is not just caused by vata dosha, pitta dosha, kapha dosha standalone. Similarly, even the Panchakarma treatments also. So pancha means 5. So usually Panchakarma is a set of 5 treatments, and usually 1 or 2 of these treatments are done one after the other in case when there are 2 doshas involved in causing a disease. So that is Panchakarma. After Panchakarma treatment, which spans for roughly 1 to 2 weeks of treatment, then what we do is with Panchakarma done, all the toxins are thrown out of the body, all the aggravated doshas are already thrown out of the body, so much of the problem is solved. But some doshas will still be lingering on, and so some symptoms will also still be there. Roughly speaking, anywhere about 40 to 60% of the symptoms in a patient will come under control with Panchakarma. After that, the remnant symptoms are very well taken care by palliative Ayurvedic therapies and medicines. So these therapies can be massage, shirodhara, etc. problems. Somebody is saying it echoing. Let me just try keeping this closer. I hope it improves. Let's see. So palliative Ayurvedic treatments can be massage, shirodhara, applying paste on skin diseases, or if there is any painful area, then we mix herbal pastes, herbal powders with some liquids and apply that as paste. It can be bandaging in case of a fracture, and so there are so many other therapies which are done as a palliative care. It can be what we call as kashaya dhara. For example, dashamula kashaya dhara, like dashamula kashaya is taken, a herbal tea or decoction made up of dashamula is poured slowly on all parts of the body. So this is especially useful to bring down the inflammation when the inflammation is present all over the body, especially in the joints, legs, hands, etc. So we do these palliative therapies, which again is for anywhere between 3 days to 5 days, 1 week, and then after that what we do is we send the patient back with oral Ayurvedic medicines. So this set of first Panchakarma treatment, and then palliative massage, etc. therapies, and then oral medicines, this forms the one circle of treatment protocol for most of the Ayurvedic diseases. Next is, there will be like certain diseases which do not require actually the Panchakarma. So probably there are, 60-70% of the diseases which do not require like hardcore Panchakarma treatment. For them, we just ask the patient to come to us. They come on outpatient basis, they consult the doctor would prescribe some medicines and then diet, and maybe external application like oil, herbal oils, etc. are prescribed, and the patient is sent back home. This is 90% of the cases that we see here. So only 10% of the patients that come to us require actually admission and Panchakarma, etc. therapies. Next is, there is a set of treatment called as Rasayana Chikitsa. So it is told as, or it is grossly compared to anti-aging, rejuvenating and relaxing therapies. So these are the names given to Rasayana Chikitsa. For this Rasayana Chikitsa or anti-aging therapy, once after Panchakarma the doshas are eliminated, 60% of the disease is gone. Then we give the external therapies, etc. Around 20-30% of the disease is gone, and finally the patient is given oral medicines through which the 10% is also gone. So 100% the disease is cured. But once the patient goes back, he may indulge in restaurant foods or junk foods, or his sleep may be disturbed, or he may not follow exactly what we prescribe them to follow. So then these doshas may again come up, they can become aggravated, and there can be relapse of the same disease. So to prevent the relapsing of such disorders, and also to improve the overall immunity and strength of the body, both mental strength and physical body strength, we give this Rasayana or anti-aging therapy. Very famous of all these Rasayanas, you might have already heard, is our Chyawanprash Rasayana treatment. So this Chyawanprash is one among the hundreds of different Rasayana treatments that we have. So with that given, the patient's symptoms will be completely under check, the doshas will not aggravate again, and there will be very minimal chances of recurrence of such a disease. So Ayurveda treatment full protocol involves initially Panchakarma, then palliative care or managing the symptoms with external therapies, medicines, etc. And then when the disease is completely cured, then this anti-aging rejuvenation therapies are given. This anti-aging and rejuvenation therapy is chosen based on what the disease the patient was suffering with previously. For example, if the patient had asthma or a chronic bronchitis or any respiratory disorder, usually a medicine called as Agastya Rasayana is chosen for anti-aging Rasayana treatment. In other cases such as skin disorders, what we call as Gandhaka Rasayana or Madhusnuhi Rasayana is given for long term, anywhere between 2 to 4 months as anti-aging therapy, so that the person's skin health further improves and such that there is no chance of recurrence of skin disease. So similarly, for the brain there is Brahmi Rasayana. For muscle related problems, for sexual related problems, there is Shilajit Rasayana, Ashwagandha Rasayana, so on and so forth. So an able Ayurveda doctor will prescribe the right Rasayana medicine after the treatment is done and the disease is cured. Next is, in that also, there is Panchakarma, there is a big misconception related to Panchakarma also. So usually people who come here at Easy Ayurveda Hospital, they think that every patient has to undergo all 5 Panchakarma treatments. So they ask like, if we choose only, for example, Vamana and Virechana. For example, in a case of asthma, somehow asthma is coming up again and again in this discussion. So when we treat asthma, usually Vamana is given first and then Virechana is given, and then they say that the Panchakarma is done. Then some clients become like astonished that I was thinking that I had to undergo Vamana, means vomiting therapy, and then Virechana, that is loose motion inducing therapy, then Nasya, Basti, etc. But we have given only 2. Then how come it is so? So it is not, means Panchakarma means 5 therapies, 5 detoxification therapies. It does not mean that we have to do all the 5 detoxification therapies on everyone. in a disease where kapha dosha is very high, for example, obesity or chronic cold and cough, maybe Vamana itself is sufficient. Or in a skin disease with severe itching, itching is a cardinal symptom of kapha dosha. So then we give Vamana, then itching is relieved. So when pitta is high, as in case of many skin diseases, including psoriasis, vascular disorders, migraine, and many other things, then we give Virechana treatment where we induce loose motion in the patient. So similarly, when Vata dosha is very high, we give Basti treatment or medicated enema treatment to control Vata dosha, or to eliminate out vitiated Vata dosha out of the body. In many neurological cases, in paralysis and in many diseases are very well treated with Basti treatment. So, and then there is this Nasya treatment or nasal drops, usually are given for head and neck related problems, ear problems, eye related, nose related problems, headache, migraine, so on and so forth. So usually 1 or 2 or 3 are made into combination based on the patient's doshas, how much they are aggravated and how much is the symptoms that can be seen. Based on that, 1 or 2 or 3 Panchakarma treatments are done. Next misconception regarding Ayurveda is that Ayurveda is full of bitter medicines. As soon as I write any kashaya, the patients twitch their faces. Of course, in a case where high pitta is there, we have to prescribe bitter and astringent tasting herbs and medicines. Of course, many of the Ayurveda medicines, at least some of the Ayurveda medicines, are highly bitter in taste. For example, Panchatiktaka Kashaya, Gugulu Tiktaka Grita, Mahatiktaka Kashaya. All these are a little bitter, I agree and admit, but they are bitter for your tongue, but they are sweet for your body, meaning they improve health of your body very much. Having said that, we have a lot of good tasting Ayurvedic medicines also. For example, Chawanprash is quite well tolerable and good tasting medicine. And then we have Amalaki Rasayana, we have Kushmanda Rasayana prepared out of ash gourd or winter melon, which is very sweet and tasty. So most of the nourishing type of medicines are sweet in taste as well. So, and then we have regular Ayurvedic syrups which are quite a bit sweet in taste. Then we have Asavas and Aristas, fermented liquid preparations, which are again sweet and a little bit fermented taste will also be there, but it's quite well tolerated. And this Asava and Asavas and Aristas are even prescribed in children also. For example, Aravind Asava is given in recurrent fever, immunity, weakened immunity, recurrent cold, cough, chest infection, so on and so forth. Saraswata Arista is also given in children, which is very well received by children. When there is this exam tension, fear, phobia, weakened intelligence, lack of memory, concentration, focus, so on and so forth. So, Ayurvedic medicines are a combination of both bitter medicines, astringent medicines, spicy medicines. For example, we have Trikadu very spicy in that matter. We have as well the sweet medicines also. So, and going through the comments, happy Danvantari Jayanthi, Shailaja madam has written. Thank you, madam. Wish you the same. Wish you and your family a very good, bright health and long life filled with joy and happiness. So usually, coming to the happiness part, there was this famous quote by Naval Ravikant. Naval Ravikant is a technologist and he is very famous in Twitter for his life advice. And he wrote a quote like, you think that you are so smart, then why are you unhappy? It is a very deep, meaningful quote. Many of the people who are egoistic and who think themselves as the smart and intelligent, etc., you pinch their ego or a little, they become very sad, they become hyper irritated, they throw tantrums, they make all this drama. If they are smart, then they should be smart enough to find a way to be happy. So happiness probably is a good indicator whether a person is smart or not. A happy-minded person means he has figured out his life. He has developed the tools and means to solve most of the problems that he has faced, or he has agreed and accepted that certain problems are part and parcel of our lives. We cannot live without them. And he has a very balanced mindset without excessive expectations. And he is happy. Only such person with good control over his sense organs, he is not very greedy, who doesn't have too much of excessive expectations from the life, and is very grateful for what the life has given. Probably such a mental condition of contentment, calmness, probably that is the definition of happiness, and that is the definition of being smart. Being smart does not just mean being very intelligent. I've seen many intelligent people who are smart in their career. They have figured out their life. They have figured out their career. They are so smart, earning millions of dollars. But they have figured out they figured out their work. They have figured out how to make money, but they have not figured out how to make peace with their own mind. So probably being happy should be our goal every day. It's not like long-term goal that after 40 years I will be happy. So it should be our goal every day, and probably as Sadhguru says, happiness should be the goal not for every day but for every moment. A happy mind, well-focused, calm and focused, concentrated mind which is full of happiness can make the right decisions, can think fast and bring about a change in the person's life and also of the lives of people in and around. So moving on, I'm just going through certain comments just to go through the comments and answer. There is a question that I have bilateral varicose of grade 3 on both sides. Should I go for surgery or for Ayurvedic treatment? In the varicose where there is a fluid collection in the scrotum, if it is grade 1 with just Ayurvedic medicines, somehow it can be treated. But this particular person has grade 3 level of varicose. Usually it requires surgery. So another thing that I have seen is that as soon as I say, oh no, this particular thing requires surgery, people are like petrified that, he is an Ayurvedic person, but why then he is advocating for surgery? It doesn't mean that, the surgery is not part of Ayurveda. Surgery is an essential part of Ayurvedic treatment. Just think about it. 100 years before, and somebody two gangs were fighting with each other with bows and arrows. And suppose one arrow entered from the here and came back from the back. They were going to an Ayurvedic Vaidya for the treatment of that such a dreadful chest injury. Sushruta is called as the father of Ayurvedic surgery. Even it is well accepted by the modern doctors also, or the allopathic doctors also. He is father of surgery in Ayurveda, allopathy, in every medical field possible. So surgery is very much an Ayurvedic integrated part. And at Easy Ayurveda Hospital, we have a dedicated operation theatre where we do the surgeries of piles, fistula, we do surgeries of non-healing wounds, we even treat gangrene, we do skin grafting and such other things. So for varieties of, even not only for these piles and fistula, of course they require surgeries in severe cases. Even for certain diseases such as sciatica also, we do a peculiar bloodletting therapy at Easy Ayurveda Hospital, which brings in instant relief from pain in a sciatica person. We also do that Rakta Mokshan or bloodletting therapy prescribed as Sushruta even for cervical spondylitis, many other such disorders. So it is the surgery or Shalya department or Ayurvedic surgery is not meant just for surgical conditions. It is also very useful in joint disorders, migraine and many other conditions as well. So going through the question, if you have any question, please ask. I will be glad to answer. Sir, I am suffering from chronic health issues from head to toe. Need to book online consultation with you as I am from Faridabad, Haryana. Kindly suggest how to proceed. So we offer, like I am Dr. J.V. Hebbar. In easyayurveda.com website, there is a WhatsApp chat. Just put this message there, and I myself or one of our co-doctors will guide you to how to take consultation from myself. We also do online consultation also, and with online consultation, though it is limited, it is not as effective or fulfilling or wholesome as direct one-to-one consultation. Much of the problems can surely be solved. So how online Ayurveda consultation works is that you write to us and then pay the fees, and then I myself will give you a time slot which is convenient for you. It's like I give few hours of time. You can choose like a half an hour time slot, and then I will send a Google Meet or a Zoom link through which the online consultation can happen. So please go to easyayurveda.com. There's a WhatsApp button on the right bottom corner. Click on that and start chatting with us. We will guide you. Or the number is, you can note down our WhatsApp number, 88673 85567. So in this one that we have sent, there is 15 missing. Actual WhatsApp number is 88673 85567. Somebody has asked, can we see this video later? Our signal is upset. Of course, we will keep this video live. You can see later. And this is just the first session that we are doing. In coming up weeks, we ideally want to do this type of session every week. So you can just type your questions and doubts. We will talk about that in coming up session. And I also request all of you to subscribe to our YouTube channel, Easy Ayurveda Hospital. We cover many topics, from home remedies to Ayurvedic medicines to diseases, treatments, and solving all your questions and everything. It will be of great support to us also. Please subscribe to Easy Ayurveda YouTube channel. So, thank you so much, Hebbar. I enjoy watching your online classes and information. Marianne Giovanna writes, I think I heard Marianne Giovanna word, I mean the name, at least more than 5 years if I'm not wrong. Thank you, Mary and Giovanna, for being part of our weekly classes. For those who do not know, we conduct 3 classes, live classes every week, and if you subscribe to it, you will get in 1 year around 150 classes. Then you can ask any number of questions, get all your questions, doubts cleared. And we, not only I, my Ayurvedic teacher, Dr. Guraja sir joins, and my senior Ayurveda colleague, Dr. Raghuram sir, also conducts one session in the Wednesday and all. It's not just I, it is a team of all our doctors coming together to do that online classes. Just search easy Ayurveda online classes in Google, you should be able to get it, so we can connect there as well. Thank you very much, wonderful session, Vishwanathji. Thank you so much. And if any questions, then we can answer. Otherwise, let's meet next next session as well. There's no problem. Okay, so I do not see any questions for that. No problem, we will be doing such sessions frequently. We will take a new topic every week, and we will continue exploring Ayurveda. Thank you all for being Ayurveda followers, and thank you for coming to this session on the holy occasion of Danvantari Jayanthi. I pray at the holy feet of God Danvantari for health, happiness, longevity, wealth, and contentment, satisfaction, long-lasting happiness to all of you and for all of us. Thank you. See you in the next session. Before I go off, I welcome all of you to please come to Easy Ayurveda Hospital. May not be as patients, just to enjoy relaxation therapies also. We do 70 plus different types of therapies. We do more than 10 types of hair care and beauty care treatments, so on and so forth. There are so much things to explore here. Easy Ayurveda Hospital is there in Mangalore, Karnataka. I welcome you all wholeheartedly. This is Dr. J.V. Hebbar signing off. See you in the next session. Namaste. Jai Shri Bhagavan Dhanvantari.